No, you're participating.
I didn't bring leggings, I didn't read the whole email.
No, don't you need to worry. You don't need to worry.
As long as there's no cartwheels involved.
Yes. Good evening. Thank you for coming today. What we are going to talk about, it's all about spinal health, how to prevent injuries to the back, and how can you fix it without hearing all about that you need to live with this pain. And also, you got to take painkillers for the rest of your life, that you can't do this, your spine is crumbling, all those things. I'm going to take out all the myth out of the back pain, and also how to live with this back pain very comfortably, get on with your quality of life in terms of looking after your grandchildren or your parents, all those things you want to do. How can we live a normal life with the back pain? That's all we're going to talk about. So what I want to talk about first, I want to go around and understand what exactly your problems are, and so that I can titrate the conversation accordingly. I want to make a disclaimer that it's not going to be a full-on medical advice to you guys, but it'll be generically, there are loads of information out there. Some of them are qualified, some of them are with the right credential, people are giving an advice. Some of them, everybody is giving an advice on everything. So for example, Cardi-Icuna syndrome. Everybody, including the clinicians, they are scared about it. They think that's the end of the road. Either you need a surgery or you need a wheelchair. In my opinion, that is absolute nonsense. So many patients I've seen with the Cardi-Icuna syndrome, I would keep them waiting so that situation will get better. Exactly happened to you. I'll tell you how you can get back on your horse with appropriate exercises. That will change your life. You don't need a surgery to get back on your horses. So this is all we are going to talk about. So I'll give you a few minutes for all of you to talk about your back pain. What is your experience with the spinal problems you have, hip pain, anything around the spine. Because not necessarily back pain is related to the back. You could get it from sacroiliac joint, which is also considered as the small of the back or bottom of the spine. You will have a pain from the gluteal region. That is, people think it is a hip joint. That is associated with the pelvic girdle. All these things we'll talk it through. Then finally, I want to talk about how to prevent back injuries, spinal injuries, and how to avoid the recurrence of the same problem. Then I'll take you to the next room. We'll show you a couple of exercises. Normally 3 exercises, simple exercises I want you to take home. And just get on with those exercises. They will keep your spine really, really stable so that you can minimize the pills you're taking, minimize the pain you're going through by at least 80%. That's all I want to give you. Takeaway messages. Just go home with simple 3 exercises. Discipline yourself doing it regularly. I would say at least 5 days a week. Then you don't need to go back to your doctors. You don't need to ring them morning 8 o'clock and stand in the 20 people queue. Okay? That's all I wanted to talk about. Please interrupt me and ask me any questions you want to have. So if you don't know me well, I know most of you. I'm Xavier, one of the physiotherapists from Excel Health. I've been a physiotherapist now 24 years. I've started as a very junior physiotherapist in the NHS. I worked my way up. I used to work for the NHS for the last 14 years. Amazing organization. I have nothing to complain about. I went on to work as an orthopedic practitioner in the NHS. Amazing job. I had amazing people to work with. My job was to see the MRI scan, list people for surgery in King's College Hospital, Canterbury Hospital, William Harvey Hospital. That was my job. So I see people with the back pain, neck pain, shoulder pain. After 18 months, 12 months of the onset of the problem, I see them in the NHS, make a diagnosis, send them for a scan, bring them back, confirm the diagnosis, and list them for surgery and directly into the operating theatre list. But I was given very little amount of time, 20-25 minutes, to have a consultation with the person, but I'm going to change their life. They cannot access physiotherapy or any other remedial treatment for their pain because they are at the end of the road. They haven't even explored anything. And I felt a bit sad that people haven't explored anything, quality treatment, quality rehabilitation before they come to the end of the road. I felt it's pretty premature. But I'm there sitting and listing people for surgery. Many people have the same question, what you have. Will I be able to walk again? Can I get on the horse again? How can I walk my grandchildren? I have a huge responsibility to look after my elderly mother. Most of you have seen and heard of this. These are all the questions people want to answer, but I have no choice, no time to give them the answer. You know what? After a good time, I thought, this is a time I need to come out of the national health and start my own practice and work as a proper physiotherapist and enable people to live their best. So I use my expertise and my knowledge in this subject to make things very simple for people to understand. I don't want to complicate things. Make it very simple so you take home with a very simple message. This is what I'm going to do. If things are not working, I know whom to call. That's all you need to know. Okay? So I've written a book all about health, how to live a good quality of life without taking painkillers and scary injections, all those things in the spine. You can read it, and also I've written a good guide about spinal health. Take one of it and read it. It'll give you very, very simplified information. I wrote it last year, and it talks very basic information about the whole spine. Okay? These are all the basic information. If you have it, there are loads of terminology. What you hear from your medical professionals goes out of the window. How many of you heard your spine is crumbling? One. How many of you told that you got a disc prolapse, it's not going to get better? 6 of you guys already. You got a sciatica, you need to go on tablets. How many of us? And this is going to just get worse. It's not going to get better, darling. You are getting older. Life is not going to change. How many of us heard? Honestly, this is all nonsense, in my opinion. My professional opinion, I have seen people, I'm treating people now who are 95, 98 years old. They are still leading a good quality of life. Yesterday, I saw one of my clients, Hazel, in Sittingbourne. Amazing person. She have a double S curve, and I'm sure Hazel may be on the streaming list. She double S curve of the spine, and she had loads of accidents, thrown from the top of the stairs. She rolled all the way down, broke her spine 5 times. She donated one of her kidneys, so the whole core area went through so many surgeries. And she went through osteoporosis, wedge compression fracture, and everything. You know what does Hazel do every single day? She wakes up 5 o'clock, get the cats out, then go into the garden, lift 50-liter, tub of soil, or maybe the plant. She moves them around. And she can comfortably do it every single day. Then she go to the communal area, empty all the bins out, and she come and see me once a month. Physiotherapy, regular exercise at home. She is happy ever after. There's another lady of mine, she's on there as well, Suzanne. Again, she was told that you have a massive disc prolapse by MRI scan, and it's not going to get better. You will need a surgery. The complicating picture is you have an excessive lordosis and a scoliosis of the spine. That spooked her so badly. She was in tears. That made her depressed. She thought never ever going to go out.
Is there a point to get scanned, ultimately, to find out what the issue is, and then when you get that information, and you can't do it,
So this is another big conversation we will have. Why do we need a scan? If you see a qualified clinician, you don't need a scan. The scan will tell you exactly what it is, but clinically, so imagine the MRI scan will give you 20 different information. How do you know which one is causing the pain? So whatever we see on the MRI scan, we clinically correlate it and find out what's exactly causing the pain, and that is more good information than having a scan. I would send people for MRI scan. I refer people for scan in the hospital, in the national health, and in the private hospitals. Only if I think this person needs a surgery, or I need to send them for a spinal injection. This is the only time I send them for a scan. Otherwise, clinical understanding is far, far better. This is one of the myths I get asked about. There's another historical thing happens in our families. Most of us with a back pain, we straight away ring doctor for appointment, right? Why do we ring a doctor? So if you got a toothache, whom do you ring? Dentist, right? Not your doctor.
No.
So you have eyesight problem, whom do you ring? Optometrist or optician, not your doctor. You got a spinal pain, why do we ring doctor?
I never ring the doctor.
I love it.
To get some free treatment as well.
This is what it is. It is because it's free.
Poor people.
Yes, it is free, and we have been trained and conditioned by our parents that go to the doctor, the medic will sort you out.
They want.
Why? You got a spinal pain, go and see a physiotherapist. Go and see a yoga person. Go and see a massage therapist. Lead a Tai Chi practitioner.
Yeah.
Amazing. There are 10 different treatments available, but we still go and see the doctor for a free treatment. And he gives you loads of medications. Why? Is it going to make any difference? Ice pack makes a better outcome than taking medications. Yeah? So let's talk about what is your exact problem at the moment. You can openly talk about it, and then I'll give you my opinion on it. Then we'll talk about how we can prevent injuries. Sounds good? Anybody want to start on?
Start.
Yeah.
So I broke my back three times, broke my pelvis, broke everything else. But when I finally had my MRI, they said I've got osteoarthritis for ages. I've got L4, L5 that I've fused, but I knew that anyway, so both of those. But I also had 2 prolapse discs all at the same place, which was giving me a compressed spine with a borderline cordial recliner. And the radiologist rang me up and she said, "Can I talk to you now?" And I said, "No, I'm about to ride my horse." "Get away from your horse! You can't go anywhere near your horse," she said. And then it burst. You can't. And then I burst into tears because obviously it was that bad. And that was that. And then I still haven't seen the NHS people. Apparently they're going to discuss me on the 17th of June. But in the meantime, I've been everywhere seeing everybody else to fix me privately.
So how many times you went on YouTube to find out the answer for what is Kara Ikuna?
Yeah.
How many times you've been into the Google to find out what is Kara Ikuna?
Loads of times. But
Loads of
I
times.
actually went and saw a neurosurgeon up in London because I just thought, well, I've got my MRI now.
So how is your anxiety level at the moment?
Better once I saw him because he told me it was rubbish, and as I'd sat there for 12 weeks and not known anything at all, he then examined me and said, actually, your discs have probably shrunk.
You can hold it.
And so if your discs have shrunk, as long as you continue to do that and you build your spine up, you may not need the thing. But he told me I could have my spine injected and my nerves
Quadrated, yeah.
And I just thought, I'm not going to
No.
do good if I have that, because
Yes.
otherwise I'll just carry on doing what I've been doing and
So-
hurt myself again.
Anybody watching out there worried about Kara Ikuna syndrome? Yes, it is medical emergency, but speak to a qualified medical professional before getting worried about everything. Kara Ikuna syndrome, it's a syndrome, it's a spectrum of problems. You may be on the lowest end of the spectrum, or you may be at the worst end of the spectrum. If you are on the worst end, we would airlift you to King's College Hospital. You will be transferred to the theatre within another 20-30 minutes, need to be operated. 24 years in physiotherapy, we always check all these things. How many people have airlifted to King's College Hospital? 2 so far. How many people have rushed to Medway Hospital for a scan? Maybe 4 or 5. And the doctor will say, it's okay, we'll wait and watch. I worked with so many spinal surgeons. They're all cool about it. But we warn people so that they don't go and do silly things. It's a spectrum of problems. You may be on the lowest end, or you may be on the worst. If you need to speak to somebody face to face, seeing the scans, then we'll tell you exactly where you are. What are the things you need to look out for so that you don't have the problem further. You can make it worse, or it can progress on its own. If you have an infection, something inside, that will make it far further worse. Okay? So luckily, you didn't have any of those problems. You have rested it enough. and simple exercise would help you, and time would scar the disc back to normal level so that the compression of the spinal column or the cauda equina, what we call it is, they'll slowly released. It'll scar back.
Yeah.
It's never going to be life-changing if you're on the lower end of the spectrum. You will get back to a full normal life. You need to be careful, mindful of what you do, but I have no limitation to say that don't do this, don't do this, don't do this, as long as we are sensible. What's your history and story with the back pain?
I've no diagnosis. I've had what I'd call chronic back pain for over a year. Maybe linked with, I don't know what triggered it, but possibly I fell out of a loft 2 years ago.
Yes, that's right.
Broke my pelvis.
Yes.
So I don't know if it's linked with that, and it's been ongoing. I've had some treatments. Yeah, initial consultation with the doctor was take painkillers, go and get some physio he gave me.
Yeah.
Not private, and hasn't really got me anywhere. So I'm still really having flare-ups, basically.
God.
I don't know what to do.
So this is what, do you remember I talked about? Pain can be around your pelvic area, but it can give you back pain. Exactly that.
So I've had like stiffness where back in late April last year I couldn't even put my socks on.
Mm-hmm.
So a lot of stiffness. I don't know what it is. I have gone back.
So can you comfortably cross your legs over?
Yeah.
No, like this. Knees over the other knee. That's good. And the other side?
I've pains. I want to know what it is basically and what I can do.
That's it. Easy as that. If we tell you
Get it better.
exactly what it is, empower you to do the right thing, you'll be fixed for life. Honestly, I'm telling you. And you are pretty good with the exercises. And Maria, by profession, she's a massage therapist. And she's very superb, alert on nutrition inside. So she's not going to put too much weight around the pelvic area and core area. She'll be good. But again, right information needed.
And I'm very physical. I have a dog. I do agility.
Yes.
It's preventing me doing that properly. I can't run as fast. All those things. I want to be.
Maria, let me see you in May sitting on one day and we'll sort you out. Don't you worry. Don't you worry. Honestly, this is all the myth I get to hear so many times. There was a patient of mine. He was looking forward to his retirement. I'll tell you loads of stories all about these patients. Looking forward to his retirement. He was 64 or something from the Royal Mail, not Royal Mail, the energy company, National Grid. His job was, after digging the pole, erecting in place, he needed to go and inspect, put the thing in, measure everything. That was his job. He had a massive disc prolapse. Before that, he ride his bike twice a week, Saturday and Sunday, minimum 60 miles a week, in the morning, Saturday and Sunday, 60, 120. Every day morning, indoor cycling and exercise, that gave him the sanity, and burpees and circuit exercise, all this. Such a fit guy. Nobody can figure out why he had such a massive disc prolapse. I told him, yes, you are a cat on the wall. You may fall into the surgical list, you may fall into the physio list. So I sent him to the hospital. He had the MRI scan through Benetton. It took so long for him to see a consultant after that. I don't know why, but I kept treating him. After 7 weeks, he got to see the consultant, and he looked at the image and he looked at the physical findings. He was 80% better from what the image was showing.
So only after 7 weeks.
7 weeks. He saw the consultant because it was private. If it's in the NHS, he would see maybe 3 months, 6 months, something like that. So 80% better in his symptoms. The surgeon said, I would love to operate the guy who's on the MRI scan. But this guy is now 80% better. I don't need to operate you. Go and see the physio again. Carry on with it. If you need, give me a ring. And
Just to say, I did have some osteopathy and a bit of massage. And by the time I got to see the consultant for the NHS, it felt a lot better. So
that's it.
And he poo-pooed osteopathy and.
No.
Well, that's got me to where I am. But then it has flare-ups.
Every profession has their own merits and advantages in everything. I've seen so many people practicing Tai Chi and maintain a very beautiful, healthy spine. I've seen people doing regular Pilates, still have a back pain as well, but physiotherapy helps them. So you need to find what makes it better and fix it that way. What is your relationship with back pain?
Well, it's many, many years ago. I don't know what happened. It's 35 years ago. I had a miscarriage. And then I never got any pain in my body at all, you know. But 35 years ago, I have got, but I won't believe the tablets or anything. And I just do nearly 28 years. I do the full body massage every once a week. The lady used to come to my place nearly 20 years. And I didn't take tablets, you know.
Amazing.
No, I don't like it, yeah. So
I love the people who give up on tablets.
no, I won't. So, and then she gave up and I found one of the person, his name is Tony and he's such a nice person as well. So I used to go once a week, then fortnight, then now once a month. But now my back pain is getting
Yes, yes.
many years ago and now, you know. But I do lots of walking, running, yoga, Pilates and everything. But I think 2 years ago, 1.5 years ago, my goodness me, my back collapsed again as well. And then of course I went to America and checked up everything. And they said everything's with my L 3, 4 and 5, the bottom one is 3, 3. And my dates is, of course, it's one out many, many years ago as well. But then he said, you don't have to, and I don't believe the surgery. I like to healing myself properly. But I used to walk lots, every second 10 miles or 15 miles, you know, but I couldn't do it nearly 1.5 years ago. I want to get back to normal, but I couldn't do that until now as well. I'm better than I was.
Yes.
Yes,
Yes.
I must say that, but I don't take tablets. And then somebody, one of my friends, her name is Alison, she I think used to come to see you.
Yes, yes.
And then she suggested me to come and see you, so I came to see you. So I'm much better, but
Still there is a niggling problem.
yeah, so I have to come back and see you again.
Again, absolutely. So let me talk to you a few minutes
What
before.
about my L3, 4 and 5 and my D's is one out as well. So
Second, what was it?
my L3, 4 and 5, the bottom one.
So let me take you to Maidstone High Street. We find a company to do a free MRI scan for every 100 patients out there. Find me one person who hasn't got a wear and tear at L3, L4, L4, L5 and L5, S1, which is very common after the age of 45, period. So how often do you change your car tire? How many times we have changed this tire? Never. You are just 45 plus, right?
You think so? I'm 64.
Yes, 64, look at that, how healthy you are. And the car tire, which is far stronger than our disc, 100 miles maximum, 40 miles or 40,000, 50,000 will change the tire. But the same car was driven by us. That means this tire has got done more than our car. But we don't change it. So the wear and tear is common.
Exercise, yeah.
Just keep it supple. The secrets of keeping the spine very comfortable is, remember this is your pelvis, very well. The most complicated part of the pelvis relationship to the spine is the sacrum. Yes, the pelvis joins the sacrum, covered by tons of ligaments there. Then on top of it, your L5 just merge with your sacrum. That's your S1. If you see here, you got a beautiful lordosis here. Then you have something called kyphosis on the top. Then you have a lordosis on the top. Okay? So here's the biomechanics of it. The line of gravity falls exactly just in the front plane of your spine, just in the front of your L4, L5 area. So that means the whole upper body weight concentrates at the L4 level, then diverge, then split into two, goes down on both the feet separately. That is the reason the focal point will be L4, L5, L3, L4,
L3, 4.
L3, 4. That is the most common area where you get the wear and tear. Have you heard of a disease called lumbar canal stenosis? lumbar canal stenosis. Most people would have got it. Cardiac syndrome, people will say that. So the lumbar canal stenosis, always at L3, L4 level. When I was a junior physio, I used to think it should be L4, L5, S1 area because that's where the most of the weight bearing goes and separates and everything. Then after the time you realize it mostly at L3, L4, that's where most of the weight bearing goes. So many of us in England have been taught that we shouldn't bend our spine when we're bending over. Is that correct or not? So bending over, should we bend our spine or not?
No,
Say
no.
bend your
Bend
knees.
your knees. The knee.
Bend the knees, then
And spine is straight.
bend your back. So, so you got a suspension in your car. Is it right to use the suspension when you're driving the car? Of course, yes. Yeah? Same way, you got the suspension, which is your disc, covered by strong ligaments. Why shouldn't we bend our spine? What we forget to do, engage our core muscles.
That's right, yeah.
Yes?
They always say it, yeah.
So, it's equivalent to, if you're thinking that I shouldn't be bending my spine, equivalent to having a nice cup of coffee, but I'm not drinking. What's the point in having a coffee? Simple as that. Why did we do this way? This is a professor from Australia who taught us this. He says, our system in England do not want to take the liability if you injure your spine at work. Royal Mail. If you injure your back, that's it. They will write you off for their life and they need to pay you for the rest of your life. So what they said, do not bend your spine. Bend your knees, bend your hips, all those things. But we got a beautiful suspension system throughout the spine and you engage your core and you could bend very, very well.
And at the same time, knee bend as well?
Yeah, you could bend from the knee and hip, absolutely no problem. I would slightly bend my knee and I bend more from my hip. Then I would take more movement from my spine as well. But I would engage my core.
Yeah, they do always say that.
How do I know whether I'm engaging my core muscles or not? Shall we do a little experiment?
Yeah, please.
Okay? Simple as that. What you're going to do, find your next partner. All you need to do, you're going to give a punch in your tummy, next person's tummy, and you just control it
I
tight.
will be scared.
Okay? Come on, do it.
I'll do you.
As long as you're not pregnant, you could do it. That's it.
I'm just answering.
Yeah, look at this. When you are poking into it, do you feel a resistance?
It's too much fat.
It's not a balloon with the water you're punching, then it's coming out. Now, make it tight and you feel the muscles are active. Then do whatever you want to do with it. As long as the core is engaged,
Engage, yeah.
you're absolutely fine. It's equivalent to wearing a corset. You know, when you injure your back, what do? Wear a corset, right? Yes? Did they tell you need to wear a corset?
No, because my body is too wrong to get it. So.
You could get in a corset, definitely.
I think I'm these and then lumbar things.
Yes. So all these things people will say that. Corset. But my opinion is you have an active corset within. Why don't we just activate it every single day, every single task we do? Easy as that, right? Just palpate yourself. Just feel it. Make sure you feel the muscles are active. I would say go from there all the way in. Do it.
I think most people don't engage in generally.
That's it.
Let it flock out.
Exactly. We don't engage it. Maria, when you're working, if you put one foot forward and then work on it, you would have no back pain anytime. Most of the problem we come because we stand like this.
Quite a lot.
Yes. Because you lean back on the bed, isn't it?
Or just like to get low.
Yes.
You kind of.
That's a good thing. But again, if you put one foot forward, the line of gravity completely changes. The weight bearing goes to the base of the support rather than into your spine.
Also, like some people have flat back, don't they? So you're going to get more going down,
Yes.
aren't you?
So this conversation, very, very important. Again, spinal health is simple as anything. but medics complicate it so bad. Why do we have a flat spine?
I mean, like sometimes you might get the
Yes, yes.
So the kyphosis bit, you're going to get a flat back.
Yes, like this, yeah?
Yeah.
Like this,
Why?
flat
Is it
spine.
flexible?
No, tell me one more. Why do we have a flat spine?
Genetics,
No.
posture,
Posture, why?
To stand.
too much sitting,
No.
standing. Don't know.
The correct answer is your hamstrings are so tight. Where's the hamstring starts from? Here,
Yeah.
on the ischium area, on the bottom of your bum area. So this is the way it should be, right? Tilting forward. From there, that is so tight, that pulls it forward. What happens? Straighter. Now this becomes a car without a suspension. Always remember this.
Lumbar, right?
Lumbar area, flat lumbar spine. This become no suspension at all. So every irritation goes through the joints and the facet joints. Then you will develop facet arthropathy. You will develop disc degeneration. You will develop chronic back pain. And when these areas are tired, then you'll get a sacroiliac pain. Once that's exposed, you go into the hip joint. Okay? So my advice, stretch your hamstring. I'll show you a little bit later. And keep the spine nice and mobile, and bend over if you want to. As long as you contract your core regularly, absolutely you don't need to worry. I'll show you how to contract your core as well later on. Okay? Now, what is your experience with a chronic back pain? What do you want to achieve today?
Miracles, really.
I got it. I'm training to be a Jesus.
I've had MS for 36 years.
What did you have?
I have MS,
Yes.
and for 30 of those years, I've tried to keep walking. Everyone said, keep walking. But because I have dropped foot and hyperextension in my knee,
Hyperextension of the knee.
yeah, this knee. So this hip has been helping lift this leg for years. And I suppose probably about 2 years now, I've been struggling just the pain has got worse and worse, and the tension and tightness of hamstrings,
Yes.
side here and my back has just been getting worse and worse. I now really can't walk, and I've got a wheelchair,
Oh, God.
I've got this, and I've had so many falls because of the pain. Because if I bend wrong, or just try and pick something up, pain just is so much that it knocks me over. So I'm
God.
covered in bruises at the moment.
Oh God, that's the reason you got a big jacket with the sleeves all over, covering it up.
I've got one bruise at the moment, but yeah.
So here, if you understand the biomechanics of it, why you are trying to hyperextend your knee joint.
I'm not trying to, it just doesn't.
It's happening,
I've
right?
got no
Why?
control.
The body is doing it for yourself. Because the body do not find the core stability active to control and keep it erect. The body is saying to you, how can you lock your legs so that it doesn't collapse? By tightening the thigh muscles, push the knee backward. That means you go into the arching of the knee joint. That leads to hyperextension of the knee. That locks it. That means the pelvis comes forward. Center of gravity well maintained so that she feels a little bit safe and steady. But still the fall will happen because none of the muscles are working enough to support the spine.
I've had the MRIs and recently, and they've said that my spine is now bent. I've bent my spine. This hip is higher now.
Yes.
And I've got 2 bulging discs, and yeah. So I'm waiting for injections into my lumbar spine.
You need to see me. You need to see me before your injection, please.
Okay.
Make it as a top priority.
Before Christmas I had
So this injection, I would keep it as a last resort before the surgery, or
I had
if you don't-
in December. What did you call it? The
sacroiliac joint.
Yeah, that joint. And so I had a pain-free-ish Christmas,
Yep.
which was lovely. And I just want another
One.
3 months to be great. I just not asking for
Again, we are not trying to find a permanent solution for your problem. So last Friday, Max, and if you could see my diary here, one of my client who is 48 years old, he's diagnosed with multiple sclerosis. He's adamant, I don't want to believe my diagnosis. He's running minimum 7. He was my last Friday first client. He runs minimum 8 to 10 mile a day. Goes to the gym 3 times a week.
Like to do 8 or 10 steps. Be nice.
And he is healthy as anything. And when I saw him first in Maidstone Studios, he was just limping like this because the calf muscle doesn't want to power up. Interesting patients I get to see. And I put him on the, the stepper we have in room, made sure jump up and down, activate the calf muscles. Because I was 100% confident it's nothing coming from the spine. It's just the nerve which was irritated. Now he can hop up and down with the dumbbells on his hand. Multiple sclerosis, yes, it is a problem, but that doesn't need to disable you. That's my opinion. Injection is good, but it's a very temporary relief.
Oh, no, it is temporary. And he said if it does work, then they'll know which nerve to
Yes.
hit. And I thought he'd said, I know he didn't, but I thought he'd said, if we know which nerves they are, then we can sever them.
Yes.
I'm sure he didn't say I can sever them.
No, it is. It is the procedure called dorsal rhizotomy. That means you will never ever feel your sensation beneath your legs. That means you don't have any sensation back, you don't get sensation down. Now, important question to you. Please answer this.
Right.
How many sessions of physiotherapy you had, and what was the quality of the physiotherapy?
I've had I don't know how many, hundreds.
Was it for MS or for back pain and the sciatic pain?
For both, really. It's sort of merged into one. But more osteopath than physio. I had physio because I've got a FES.
Yes.
And so I've had physio for that, to learn how to use that and things. But yeah.
How often do you?
Everything.
How often do you do those exercises at home? For your back.
I've never been given any for my back.
Okay, I'll give you just 3 today.
Okay.
Just stick to it. Just simple 3.
Be good to know.
It's simple as that. Okay?
That exercise.
That's your take-home message.
I like my exercise.
Yes, you do lots of it, but I do simplify it. Just 3. Okay?
One thing I did want to ask you is what is the best position to sleep in with this condition at the moment? Because every position I'm in hurts, so I end up sleeping sitting up.
Oh.
Wow.
I don't actually lie down, it hurts.
Because of the back pain. Okay. My preferred position for this kind of problems on your back. I don't want you to put a pillow or anything on the back of the knee. Just one pillow for the head. Lie on the back. Periodically you can swap to the side, back to your normal lying on the back.
It hurts too much.
Is that the reasoning behind when you're lying on your back, the weight is taken over evenly by your mattress. If you lie on your one side, the weight goes vertically into the body and your spine dips.
Right.
That can give you the irritation. Because the body area is smaller on our side, right? But if you're on your back, the width is quite wider. So the resistance and the amount of weight distribution is broader. So the resistance and the discomfort on the spine is far lower. That's what I would recommend. Many people try pillow in between the legs. That's good too. That's a very good position.
Oh, yeah. For me.
Everybody.
Oh, I see.
Have you heard of this pregnancy pillow? People use the one big banana. I heard that this is another good posture for people to sleep in. People feel so comfortable with it. If that makes it happy, do it.
That's sort of like in the recovery position.
Yes, yes. Little bit of recovery, but you are cuddling that big pillow. Sir, what's your problem there?
Yeah, I have MS too. I'm not troubled so much by pain in the normal course. I get discomfort of a night time in bed. I don't sleep. I don't sleep very well because I can't get comfortable. But for me, my main problem is mobility and like walking and standing upright, which I'm personally convinced is completely unrelated to the MS.
Yes, yes.
And obviously I'm keen to learn how I need to, what I can work on to try and because when I walk with a relator now, because if I walk without it, I just want to bend forward all the time. I can't keep myself upright and erect. But when I'm doing the washing up at the sink, for example, I can't just stand.
Here it is.
I'm leaning forward.
So, if you're going for shopping without the rollator, you will lean onto your trolley, right?
Yeah.
Without that, you would feel so much pain and you feel like you need to lean back with the support. And if you keep on walking with the trolleys, eventually you will be just lying on the trolley, right?
Yes.
Look at that. Now, have you ever felt your legs are becoming so heavy that you can't lift your leg and you feel like you need to drag your legs? This is called lumbar canal stenosis. Do you remember I was talking about? Everybody would have been having one of those due to wear and tear. Lumbar canal stenosis, where the tunnel, the nerves are going down, is getting narrowed due to wear and tear. That is a classical symptom. That narrowing is contributed by the broadening of your facet joints. So imagine, how do I put it, simple way, apple with two leaves on both the sides. So the core apple is covered by the leaf because the leaf has become so big that is encroaching into the apple, that's hiding the apple. That means you cannot eat the apple. Let's put it in this way, so that the tunnel gets overshadowed by the broader facet joints. He cannot stand straighter, so he needs to keep the spine open. So he slowly bends over without his intention. He leans, then slowly he'll be going like this. Then he'll slowly start dragging the legs, and he needs to sit down somewhere. Most likely, if you are on your out, you would be bending over like this. That would ease his pain. This is lumbar canal stenosis. Facet joint arthropathy is the problem. We would mobilize the joint, loosen them, everything, get your sciatic nerve stretched out. You would feel a lot better. Obviously, this problem is never going to be completely cured, but you don't need to cure it. You don't need to cure all these problems. Wear and tear. Just we need to learn to live with it. And things will improve a lot better. Many people will go through just a walking stick and walk around.
Yeah, that would be fantastic.
Look at that. I don't promise anything too much. So if I get you to walk from your house to your corner shop to get your newspaper with a walking stick, you will be happy to start with.
Yeah, very much so.
And if I get you to walk around your golf course, 1 hole, 2 hole, that'll be even better. Yeah.
Yeah, I mean, to be able to walk a modest distance,
Yes.
preferably without any stability,
Yes.
would be fantastic. I mean, it's only within the last 8 years that I've actually needed support. Things seem to have...
So here, your diagnosis of multiple sclerosis just complicates things. And people kind of say, just for the safety, just get something on you. That reduces the confidence level as well gradually. That's one of those things.
Well, that's it. I think it has sort of distracted from the
Yes.
underlying issue.
Yes, it is.
Everything's been blamed on
Multiple
MS, so
sclerosis.
just looking
Yeah.
at the MS, when I don't think it's that at all.
No, it's not at all.
Largely not.
It's very hard you to say these things to your consultant, right? You can't say to them, MS is a separate problem. What I have with my spine is completely separate problem. So that's called lumbar canal stenosis. We talked about Cauda-Equina syndrome. We talked about lumbar canal stenosis. We talked about sciatica pain. What is your problem with the back?
So I used to run every day, play netball, 3 children, full-time teacher, so very busy, very fit and active. And then 3 years ago, during first Christmas of lockdown, I had a very sharp pain in my groin. agonising pain, but because I ran every day, I kept running on it, and then it got to the stage where I laid down after a run and couldn't get up. But because it was locked down, I couldn't go and
Get to see anybody.
And then when I was seen, I went to see my osteopath, and I couldn't open my legs.
Yes.
So this leg, very
Yep,
flexible,
yep.
this one, that much flexibility. She worked on it. The pain was unbearable, and I kept going back to see her, and then it got to the point she said, I can't do anything else for you, you need to go and see your GP. Went to see a GP, got x-ray, went to see a physio to give me the results, and he looked at my hip and said, you need to have
Hip replacement.
Yes, I had that last February, but my other hip, they said, could degenerate, and in trying to fix this one with the physio, I started yoga and Pilates. I've never done those two things before. Absolutely love them. Started swimming 5 times a week, front crawl only, so really looking after myself, but it degenerated this hip quicker, so now I'm on a waiting list for this, but and that's imminent.
So where do you swim?
Moat Park.
Moat Park, okay. I'll tell you another story of my client. You may have seen him in Sittingbourne practice. He comes on once a month, Thursday evening, 6:30. He's a teacher. He was a head teacher in Gillingham area, then moved to Sittingbourne as a deputy head now, and he has flattened hip joint on both the sides due to pathology. Nothing to do with running. He's a golfer. Both the hip joints, the rounded head has gone half the size.
Mine was smaller, yeah.
Yeah, half the size. This is the worst it can get to. And he still plays 2 rounds of golf on the weekend. On the school holiday time, every day he plays. All the full holes, 18 holes he'll play. And
I choose symmetry at the moment because this hip feels strong. And my glutes feel strong on this side, but my strength here isn't great. So it's my lower back. I've never known anything like this. My lower back.
Yes.
If I bend forward, I feel like
It
a
will be.
ruler that could snap. There's
Yes.
that sort of tension.
Yes.
And I've been doing stretches, so I'm just really interested to see. I'm a bit concerned that after this operation, because it's been 3 years with my back, I'm a bit worried I might not get my flexibility back.
You will, don't you worry. So this gentleman, now he is 62 or something, or 59 something. He may not like me saying the age. 59, 56, 59, 60. And he swims 5 days a week in Reynolds gym, plays 2 days a week golf, and he sees me once a month. He's been 90% pain-free completely. If you're going to ask him, Dave, when do you want to have a hip replacement? Never. Do I need one? His leg can open up this level.
What are you saying?
See the physio properly.
Are you saying not to have a new hip?
I'm not saying that. I need to look at your x-ray.
For my new hip.
I'm not saying that, but the answer is you will get your flexibility back.
Yeah.
That's all needed.
Yeah.
If you don't have a mobility, then you need a surgery. Mobility is the key.
Yeah.
Who provides the mobility? Physios. Nobody else. That's all you need, honestly I'm saying. If the mobility is right, then go and have a hip surgery if needed and prevent your back pain and everything, then you'll be absolutely fine. Okay? So, timing wise, I think we are good. So what I'm going to do, now we might cut the live streaming off and we will take you to the